Hi, my name is Tammy Grimes, and this is my final assessment. This is my client. She denies any family history of genitourinary or gastrointestinal cancer or colon polyps. Her mother, myself, has had gallbladder disease in the past, and I had a cholecystectomy. My client does admit to weight gain. She has never had any abdominal surgery or GI illness, and she has had occasional constipation in the past. No change in her current bowel or bladder habits, though. She states that she has a bowel movement daily of a formed brown stool. She is not on any medications. She denies any food intolerances, and all of her immunizations are up to date. Upon inspection, you can see her abdomen is round with generalized systemic distension. She does not have any scars, but she does have white striae across the bottom of her abdomen, which she refuses to show you. Upon auscultation, we're going to listen to her bowel sounds in all 4 quadrants. And you listen for 5 minutes, a total of 5 minutes, which I'm not going to do on here, because that would just take up way too much time. But upon listening to her abdomen, I did hear the boraborgmy. I can't pronounce it. Also, there were no renal or iliac rubies heard. Next thing we're going to do is percussion. And percussion, we're going to percuss along her abdomen. Most of it should be tympani, with dullness sounds over her liver, spleen, and her stomach area. The liver span can be obtained by beginning at the right midclavicular line. You're going to go from an area of tympani and just work your way up until you get to the dullness. And you're going to mark that line. And then you're going to start up here from an area of resonance and come down until you get to another area of dullness. And then you're going to measure it with a tape measure. And we got 10 centimeters, which is in the normal range. Normal is 6 to 12. A number larger than 6 to 12 indicates liver enlargement, and smaller indicates atrophy. To perform the liver scratch test, you're going to mark her borders. You would just put your stethoscope on the abdomen, and you're going to scratch with your finger along until you hear area changes in the tone again, and then you can learn where the border of her abdomen is. No laughing. Let's see. The next thing is to percuss the spleen, and it's going to be just posterior to the mid-axillary line on her left side. You can percuss in several different directions until beginning at the areas of resonance. Areas of splenic dullness should be from the 6th to the 10th root. Next thing is palpation. You're going to palpate along the abdomen, make sure it's smooth, no abdominal masses or rigidity. Any pain? No. Deep palpation can be performed to identify the liver. You should be able to feel it just below the rib cage, and you can follow that along. And then the spleen and kidneys. And she also had no pain with that. The fluid wave test is performed by having the patient lay flat, which she is. And I want you to take your hand, Haley, and lay it directly in the middle of your belly, like so. And then I put a hand on each side and tap with the fingers, and I should not feel that on the other side. If I do, that indicates that she possibly has some ascites. The next thing you can do is shifting level of dullness, which you have her turn after you've done your assessment and know where your areas of dullness are. You have her turn onto her side, repercuss all of those areas, and then if the areas of dullness change, then that means the fluid has shifted, and she possibly has ascites. They should stay relatively the same, though. The last thing you can do is check for costal vertebral area tenderness, which is you have her sit in a sitting position. I'm going to stand behind her, and then I would take the palm of my hand over the costal vertebral angle and hit it with the ulnar surface of my hand and see if she has any tenderness in those areas, which she did not. The next thing is the neurological assessment. She was oriented to person, place, and time. Her Glasgow Coma scale was a 15, which is normal. She was pleasant and smiling then. Her behavior was appropriate. She had 0 errors on her mental status examination, indicating no intellectual impairment. Next thing we can do is a hand-face test, and you can have her close her eyes and then touch her hand. Close your eyes, and you're going to touch an area on her face and or one of her hands, and you change up which side they are. So like I could touch here, and you use about the same sensation, and then she tells me where I'm touching. Where am I touching?
My cheek.
Louder.
My cheek.
Is that the only place I'm touching?
My hand.
Which cheek and which hand?
My right cheek, my left hand.
Okay. Now what am I touching?
My left cheek.
Anywhere else?
I don't know. No.
No. Okay. So you do that, and you want them to score 6 or less for that to be normal. So she did pass the hand-face test with a score of 0. Next thing is the cranial nerves. The first one is the olfactory nerve, and it is tested by having her close one nostril, and then I put different aromas underneath her nose, and she has to correctly identify the smells. Number 2 is the optic nerve, which we previously tested with the Snellen chart. Number 3 is the oculomotor nerve, and was previously tested with the confrontation test. Number 4 is the trochlear, and you inspect the eyelids for drooping, and hers were normal. Number 5 is the trigeminal, and you check the face for muscular atrophy or tremors. And you can also check the corneal reflex, which we also did on another video. Number 6 is the abducens, and is checked by looking at the pupils and checking the response to light, which we did on a previous video. Number 7 is the facial nerve. You look for facial symmetry. And then you have her like smile and blow her cheeks out and make sure everything is still symmetrical, which were for her. Number 8 is the acoustic, and was previously checked with the whisper test. Number 9 is the glossopharyngeal, and is checked by having her identify sour and bitter tastes, which we have not done. Number 10 is the vagus nerve, and you check a gag reflex and her ability to swallow, and she passed both of those. The gag reflex was just checked by putting a tongue depressor in her mouth until she gagged. And then the swallow test, we just had her drink some water, and she did fine. Number 11 is the spinal accessory nerve. It is checked by having her shrug her shoulders against pressure with me holding my hands on her shoulders. And number 12 is the hypoglossal nerve, and is checked by having her stick her tongue out, and then you look for tremors or symmetry again. Gross motor movement is checked by watching her gait and balance. She did have a steady gait, and her balance was good. Had her do the heel to toe walk and hop on one foot, and her balance remained normal with those. Let's see, the Romberg test we did by having her stand with her feet together and close her eyes, and she did maintain her balance. Fine motor movement was checked by doing a rapid alternating movement, and we had her take her hands and go on her legs back and forth, up and down, and she did fine with that. Can have her do her finger to thumb test to also test for fine motor movement, and she does fine with that. Sensory tests are performed by touching her lightly with cotton swabs in different areas of her body and having her describe where those are. You can also test sharpness and dullness, or heat and cold. Vibration tests are performed with a tuning fork, which I no longer have, but you place the vibrating fork against different bony prominences, and she should feel a tingling type of sensation to wherever you're touching. And then deep tendon reflexes were tested using a reflex hammer. For the biceps, you hold her arm out at a 45-degree angle, and you test at the deep tendon fossa here, and you would put your finger on there and tap your finger with it. You don't want to hit it directly. and she should have some contraction of her bicep muscle and flexion of the elbow. The brachiodorsalis is then tested with her forearm, also the same, and you strike that tendon, and she should pronate her forearm and flex her elbow. The triceps reflex is checked when her arm is at a 90-degree angle with her hand facing down, and you strike the tendon just above the elbow, and her elbow should extend. Patellar reflexes were checked having her sitting and striking just below her knee, and she extended her leg. The Achilles reflex was checked by holding her foot in my hand and striking the tendon at the malleoli, which is on the back side of your foot, just above your heel. And she did have plantar flexion of her foot. The last reflex check is the plantar reflex, or the Babinski reflex, where you stroke the bottom of the foot from heel to toe, and if she dorsiflexes her great toe, then that is a positive Babinski reflex, and you should not have a Babinski reflex if you're over the age of 2. Any positive on that indicates some abnormal nerve issues. And that concludes my assessment for this module. Thank you.